Let's see, where did we leave off? Oh yes, I had the barium swallow test the day before, and I hadn't slept at all that night. So, I had now spent 2 nights in the hospital, and I was on day 3. I hadn't found any relief yet from all the vomiting and pain and everything, but my awesome surgeon, Dr. Gould, decided he would come in on the weekend and see if there was anything he could do. So he came in and thought maybe there could be some air trapped. As they're putting it in and closing the tubing and the port and hooking everything up, sometimes air gets trapped. Alright, let's give it a try. So, mid-morning, Dr. Gould comes in, and I'm about to have my very first band adjustment before I even leave the hospital. That's right, I'm getting adjusted right away. So, Dr. Gould comes up to me, he's got all the stuff he needs, finds my port, and he gets out this big needle! Ah! Holy cow, this is gonna hurt like heck! He sticks the needle in, hits the port, and I'm like, wait, that didn't hurt? That wasn't a big deal. No real discomfort, it just went right in. Huh. This isn't going to be as bad as I thought the unfills and unfills would be. Not a big deal at all. This was the first time for me seeing firsthand what it was going to be like. I hadn't watched firsthand it happen to someone else. The only thing I had seen was from Lap Band King when he got his fills and unfills. So he messed around and he got about 2 to 4 cc's of air out. I'm thinking, yes, okay. There's a little more room, maybe the swelling will go down, maybe I'll get something in. So we get out some liquid, drink, and I vomit. It didn't work! Well, I was still pretty swollen. I thanked my surgeon. He did what he could at the time. We discussed some options and we decided we were going to see if I would stop swelling and give it at least a few more days. There's only so long that they would go without having to remove the band, because at this point I'd still only been on IV saline starting now on the 3rd day, and that'd only go so long without me getting actually food and nutrients and whatnot. So, let's see. Oh! That afternoon, a fellow WLS weight loss surgery patient came up to visit me. Someone I'd met from the Obesity Help site. Melissa, Mel, if you're watching, hi. It was a little break from reality. Nice to talk to her. She did most of the talking. I was kind of out of it. It was nice to just sit there and listen and just someone else that had surgery, you know, things like that. It was really nice to see her. It was really nice she came up to visit me. I appreciated it more than probably she knows. She brought me a little angel to put up, a little angel figurine. I forget what they're called. There's a fancy name for them. I believe she brought me 2, the Angel of Healing and the Angel of something else. And I actually have those on my dresser still to this day, and they will not be taken down. Anyways, I was still trying to feel human, so at this point I was taking 2 showers a day, 1 in the morning and 1 at night. Not 100% sure why I wanted to take so many showers. It was a big deal. They had to cover my hand. It took a lot of work. I mean, we were talking like an hour plus ordeal each time I wanted to take a shower. I know. It helped me pass the time, a little break to take a nice warm hot shower. I know I liked not being attached to the cords that went all the way to the IV and because they would just cap it and put a glove on and seal the glove. Not being attached to an IV, having to push it around everywhere you go is a luxury in the hospital. It was very nice. if you have an extended stay in the hospital, I highly, highly, highly recommend taking showers. Even if it feels like it's a pain in the butt to do, you'll feel more human. It'll pass the time. It relaxes you. It's nice to get some normality. Once again, my phone's ringing. Anyways, let's see. The nurses came in sometime late afternoon, and they told me that tomorrow I'd be getting another barium swallow test. So I'm like, okay, something to look forward to. Come on, stop swelling, stop swelling, stop swelling. I'm trying to will my body to stop swelling. Okay, side note. Hi, any nurses out there, surgical staff, anyone that was involved in my care at UW Health, thank you. You were awesome. You were very kind, compassionate, just very understanding of what I was going through. I appreciate that you took the pride in your job, in your line of work, and all that you do. All the staff I had were just top-notch, incredible. Everyone was more than I could have expected. Thank you very much for making this hellish experience not so hellish. I appreciate it. Anyways, that night was spent with me pacing the halls back and forth, you know, because you want to walk a lot. I never got the shoulder pain from the gas or anything like that. Maybe it's because I constantly was walking. I was anxious. I was bored out of my mind. Oh my God, there's nothing to do. No DVR, so I can't watch the shows when I want on demand. Commercials. Commercials. What are those? I'm sure I drove the other patients on the floor crazy because I had what I called Old Squeaky. Squeak, 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 squeak. Yes. That few seconds was annoying. Imagine having to push an IV cart. That's all it did. You could hear it all the way down the halls. Everyone knew where I was at all times when I was going out for a walk. The nurses even started laughing by this point because he's out for another walk. Yeah, so next time I will talk about my second barium swallow and some more about my hospital day. Have a great day, everyone.